हर तरफ फिक्र को दौड़ा के थकाया हमने कोई दीन मुहम्मद सा न पाया हमने।
During this pandemic, our healthcare heroes are working day and night to protect us and our families. Not only are they at risk of exposure to the virus, but they may also experience stress and exhaustion because of the higher than normal number of incoming patients. In this episode of Balance, we will talk to a Toronto-based physician to uncover her experience on the front line. Today, Dr. Maryam Sheikh shares the impact of the pandemic from a healthcare worker's perspective, informing us of the medical efforts against COVID-19 and the measures in effect to care for patients who have contracted the virus.
As a general internist in a community hospital, I work as the attending physician to patients admitted to general medicine wards. There have been several policies implemented in the hospital for this pandemic. There is a zero visitor policy, meaning no visitors are allowed. Patients are isolated in their rooms. The corridors are hence very quiet. There are separate entrances for staff and patients. There are people who are assigned duties at the entrance to ask screening questions from all comers. You're required to wear a face mask all the time when you're within the premises over the last few months. Then there are also drills about how to wear personal protective equipment properly and how to take them off properly.
Although there's been large-scale suffering and loss because of this viral illness, one positive aspect of this pandemic has been a new admiration for all the workers we rely on to provide our essential health needs. Both adults and children continue to use social media to show their appreciation for essential workers with various hashtags and appreciation campaigns. In some areas of the world, like the United States and the United Kingdom, families have gathered on their driveways to applaud the hard work of essential carers on a weekly basis. From the perspective of a healthcare worker, Dr. Sheikh reflected on some of the realizations she came across as well.
Several lessons we have learned from this pandemic. The first one I like is COVID kindness. A word of kindness goes a long way. These patients, they're isolated in their rooms, they're separated from their family members, ensuring them that their family members are well informed, calling their family members regularly to update them about the condition of their loved ones, providing opportunity so that they can communicate with family members virtually is very important. Another lesson we have learned from this pandemic is that Allah Ta'ala has made human being extremely innovative. Over the last few months, we have seen tons of research about treatment options, vaccine development, how to enhance and improve personal protective measures, how to assess patients effectively in a virtual setting through virtual clinics, different modalities, how to connect people when they're separated due to physical distancing. It's just astonishing how much has been done.
Many people may remember the H1N1 pandemic of 2009 and naturally compare it to COVID-19. They are similar in that both are viral illnesses. However, COVID-19 is much more worrisome than the H1N1 pandemic. Not only is it more contagious, it makes people severely ill with a higher mortality rate. It's also a bigger threat to the older age group and those with weakened immune systems. According to the World Health Organization, older people face significant risk of developing severe illness if they contract the disease because of the physiological changes that come with aging and possible underlying health conditions. Another notable difference between the two pandemics is that H1N1 seemed to respond fairly well to existing antiviral drugs, while there's no specific standard treatment as of yet for patients afflicted with COVID-19. To guide viewers on the best source to seek out reliable information, Dr. Sheikh shares important insights.
There is a lot of information out there. The most authentic resource is public health. check your local public health website. There is tons of information for you. There is statistics of the disease, symptoms of the disease, when to contact and when to seek medical attention, where are the COVID assessment clinics and assessment centers in your area. It also tells about basic things like how to perform hand hygiene properly, when are you required to wear a face mask, and how can you do that efficiently. If you search the internet, you'll find people who underestimate the statistics of this disease and who do not follow the rules of physical distancing or hand hygiene or keeping that required distance. On the other hand, you find there are tons of videos about how to obsessively clean your grocery items and your household surfaces. There are a lot of myths being formulated these days. We need to understand the difference between a myth and a reality. Our local authorities will give us the green signal on when we can come out safely. Understanding when it is safe to come out and following all the necessary precautions when coming out, for example, wearing a face shield or a face mask, whatever is recommended by your local authorities, is very important. Getting down to zero number will be a very long haul road and may never be possible. But the good thing is that what's possible is a future with a promising vaccine and few and very short-lived outbreaks is foreseeable, possibly within a year.
As time progresses, many countries around the world will be easing lockdown restrictions. However, the key to overcoming this virus lies in our abilities to remain vigilant and continue to employ physical distancing in our social circles. According to many news articles, parents are frustrated that their teenage children are not following social distancing rules. Parents are in a difficult situation trying to reason with their children and educate them about the importance of these measures. To these families, Dr. Maryam provides an important message.
The teenagers, they look at the number, the fatality rate of 3.5%, and they say it's not that of a big deal. The important thing to make them realize, to make them understand, is that the risk is not substantial to their own health, but to the health of the people who are around them. The risk is to those who are living in their household, their parents, their grandparents. There are several people above the age of 40 who require life support because of this disease complications. And being on a ventilator is not a magical cure that will fix you in a day or so. You need weeks on the ventilator and then months in rehab or in medicine wards when you're combating the effects of the ill effects of being on the ventilator, which are a lot of deconditioning, weakness, and confused mental state. So all these things have to be taken into perspective. Talk to your teenagers. They have a lot of energy. Use that energy positively within the household. Provide them opportunities of virtual hangouts. There are also virtual support groups on how to navigate all these problems. We are all in this pandemic together. The blessing of this pandemic is that it has strengthened our faith. It has strengthened our prayers. It has provided us with opportunities on self-reflection and self-reformation. So, inshallah ta'ala, with the grace of Allah ta'ala, with the blessings and the prayers, we will all come out of this pandemic, inshallah.
As Dr. Sheikh mentioned, it may be many months before we are in a post-pandemic environment. We can all be a part of the solution and better equip ourselves to deal with this virus by cooperating with the government and health officials. By staying up to date with accurate information, we can be better informed to make sound decisions when it comes to our health. May Allah enable us to remain optimistic and hopeful in this time. May we stay safe, healthy, and united. Ameen.
हर तरफ फिक्र को दौड़ा के थकाया हमने कोई दीन मुहम्मद सा